Why are C-reactive protein levels high in diverticulitis patients? Imagine your body as a busy city responding to an emergency. When diverticulitis strikes, small pouches in the colon will become inflamed or infected, triggering your immune system to react. One of the body's main responses is producing a protein called C-reactive protein, or CRP. This protein is made by the liver and acts like a fire alarm, signaling that there is inflammation or infection somewhere inside. In diverticulitis, bacteria can invade these small pouches, causing localized infection and tissue damage. When this happens, your immune system releases chemicals called cytokines, like tumor necrosis factor alpha and interleukin-6. These cytokines tell the liver to produce more CRP. As a result, CRP levels in your blood rise, reflecting the intensity of the inflammation happening in your colon. Doctors often check CRP levels because they give valuable clues about how severe the diverticulitis is. If your CRP is below 50 milligrams per liter, it usually means the inflammation is limited and there is no perforation or major complication. But if your CRP climbs above to 100 milligrams per liter, it suggests a more serious problem, like a perforation or abscess. In fact, studies show that a CRP level of around 175 milligrams per liter has a good chance of indicating complications, with high accuracy in predicting more severe disease. CRP is often more reliable than other markers like white blood cell count or body temperature because it responds more consistently to inflammation. While those other signs can fluctuate, CRP levels tend to give a clearer picture of what's happening inside your body. Doctors also use CRP to monitor how well treatment is working. If your CRP drops after starting antibiotics or other therapies, it usually means the inflammation is subsiding. But if CRP stays high or keeps rising, it might mean the infection isn't under control, and further intervention could be needed. It's important to understand that not everyone with diverticulitis will have high CRP levels. Sometimes, mild cases may show only a slight increase, or none at all. Conversely, high CRP levels don't always mean there is a perforation or a very serious problem, but they do alert healthcare providers to the need for further testing, like a CORT scan, to get a complete picture. In summary, high CRP levels in diverticulitis are a sign that your body is fighting significant inflammation or infection in the colon. They help doctors assess how severe the condition is and guide treatment decisions. Always remember, if you're experiencing symptoms like abdominal pain, fever, or changes in bowel habits, seek medical advice promptly. Proper diagnosis and management are essential for safe and effective care.